There's an easy way to save money on your health care. Pay closer attention to what your doctor tells you. Health experts warn that not understanding health information is not just an inconvenience, it also contributes to worse health and higher health care costs. So joining us today is Dr. Joydip Roy. He is here to offer tips to bridge this knowledge gap and to help you save money. Thank you so much, Dr. Roy, for taking time to talk with us.
Well, thank you for having me here today.
Yeah, so let's talk about the connection between understanding our health and the effects on the healthcare expenses.
Yeah, you know, one of the things is that health, mental health and physical health is closely related to financial health. They impact one another, right? Healthcare and financial literacy both require grasping really complex information to make informed decisions. But when you have a better understanding of your own healthcare needs and care options you have, you're more likely to do a better job in managing your healthcare costs that you have.
Okay. What is one way that health insurance can help us save on these costs?
Yeah, there's this old adage, an ounce of prevention is worth a pound of cure. Right? So similarly, insurance can help us save on costs by covering preventative care. So like your regular preventative visits, such as your annual checkup, and certain cancer screenings are generally covered by your health plan. They play really a crucial role in helping detect diseases earlier on and trying to come to treatments that help prevent increasing costs and increasing illness. So getting those checkups done on an annual basis helps in preventing costs down the road.
Yeah, that's a great reminder. You know, studies show that more than 9 million Americans report not taking their prescribed medications because of the cost. They just can't afford them. So what are some ways we can save on our medications and be able to pay for them?
Well, it's an unfortunate truth that there's a lot of people that forego their medication because of the cost. They have to decide between food or housing or gas or their medication. And some of the steps people can take is that really understand the need for the medication from your provider and ask about alternatives that might be less expensive. Generics are a common solution to this, right? They have the same active ingredients as brand versions, but cost typically much less than brand named medications. The other avenue is really going to online pharmacy. Many health insurers have online pharmacy contracts, and that allows for ordering medications up to 90 days supply. So you're not having to rush out every 30 days to go to the pharmacy. If you do need to go to a brick-and-mortar pharmacy, it's really important to make sure you go to one that's in-network. So that might not be the one that's right across the street from you. So you really need to make sure about that one.
Okay. Good tips there. Are there other things that you recommend that we can do to keep our expenses in check?
Yeah, it's important to make some informed choices about where you seek care. Like, so one of the big things is emergency rooms. They're very important for life-threatening conditions. You know, there can be lifesavers, right? But for non-emergent or non-urgent needs, there can be other places that are better for your pocketbook. ER visits can cost about 15 to 52 times more than other care alternatives. So making sure could your needs be met at urgent care, primary care, or other care options like virtual care options could help you save money in the long run. Okay.
Can employee assistance programs help?
Yeah, so employee assistance programs, or EAPs, kind of a little secret that very few employees really take advantage of, but they have a wide degree of offerings that come about. And if you're a United Healthcare insurance holder through your employee, you can really call and speak with a clinician with a master's in behavioral health. And they provide support and as many times as you need it, and they're a resource. If you need further care or services, they can help you, link you with that for mental health, behavioral health needs as well. So oftentimes, those services, just talking with a clinician at that point in time in need, suffices for most people. But if you need that extra degree of support, that support is there.
That is great. Dr. Roy, a lot of great reminders and information today to help us with all of our health care costs. Great talking with you.